Hi, welcome for joining us today on our Beyond Cancer series. I'm Nancy Farrow and the founder of Epic Experience. My nickname is Mama Lou. Today's an important topic for so many people. Dealing with cancer is a hard impact, and it impacts everything about a cancer diagnosis, but for so many others as well. I'm grateful to the people that are going to share their experiences and their stories today, but I also want to acknowledge, even within the Epic Experience family, we have lost campers and volunteers to suicide. So I encourage you, if you feel like you want to talk to somebody, feel free to reach out to us. We'll be sharing resources today for you as well. But take care of your mental health. It is every bit a part of you as your physical health, and I'm grateful to everybody that's a part of the series today and look forward to what they have to say and sharing their journey. Thank you all. Take it away, Gail.
Hi there. Welcome to Epic Experiences Beyond Cancer series. Today is episode 22, and we are talking about mental health, as Nancy just said. If you've been following along, then you know that this series is put on by the alumni team. We're all former campers at Epic Experience, and we just want to offer this resource to former campers who haven't actually attended camp yet, to volunteers, to family members, to anyone. And today is such an important topic in terms of mental health, suicide prevention, and all of that. So we hope that you find today's episode very meaningful. We're going to be posting links that you can go to for suicide prevention if you need help specifically related to cancer and mental health. So please take advantage of those. So today we have a few former campers who are going to be joining us. And I'm going to let them tell you a little bit about themselves first, and then we'll dive in. So we have, and they're from all over the United States, and they're going to be sharing a little bit about their specific cancer journey, and then also as it's related to mental health. So let's have them join us. We have Amanda, and we have Stan, and we have one more. We have Vanessa joining us. So thank you all so much for joining us. I really appreciate it. So today what we're going to do is we're going to start. I'm going to have each of you introduce yourself, tell us where you're from, what kind of cancer you had, what your camp name is, when you went to camp, and if you want, one fun fact, just because. So Amanda, why don't we start with you?
Sure. So I'm Amanda, aka Twiddles. I am a Hodgkin's lymphoma survivor. I will celebrate 9 years in remission this April, which is insane to say out loud. I had the great pleasure of going on the Hodgkin's specific camp. And then I also had the great opportunity of volunteering at the following year's camp. I am from Baltimore, Maryland, but after camp, probably about a year right after, I moved out to Colorado. So now I am a local in Arvada, Colorado.
Awesome.
Yeah. Oh, my fun fact.
Yeah, please.
Sorry. My fun fact, I have a dog named Gracie that's you're probably gonna hear her at some point.
Awesome. Stan, how about you?
I'm Stan. My camp name is Sailor. I can't remember the exact year I went to camp and discovered Epic. It was about 3 years ago in February. Hodgkin's lymphoma survivor, though at the time I was diagnosed, it was known as Hodgkin's disease. That was back in 1974. I was 13 years old. So you might have to help me with the math, but I'm completed treatment in 1979, the same month that I graduated from high school. It was about a 5-year ordeal, a lot of surgery, a lot of radiation and chemotherapy. As I said, I've been to camp once and then back twice as a volunteer, specifically during the Hodgkin lymphoma weeks. And that's where I met Amanda, right? Yep.
Awesome.
And I think my fun fact is also my dog is sleeping here at my feet. You may have heard from her. Her name is Scarlett O'Hara.
Ah, love it. Vanessa.
Hi, everyone. I'm Vanessa, also known as Bettina, and I will stay muted because of all of my aminals. I had acute lymphoblastic leukemia with a chromosome mutation and went through a bone marrow transplant. I'm coming up on 8 years since diagnosis. I crossed over 7 years post-transplant in February. And I live in Pewaukee, Wisconsin, so the southwest or southeast corner of the state. And what else? So fun fact, I have 3 cats and a dog, and love everything outdoors.
Awesome. Well, thank you again. This is a tough subject, and I really appreciate you guys being here, for being willing to share your story and talk about these things. So we're just going to dive in, okay? How do you feel in terms of having cancer and then launching into real life? Do you feel like you were prepared for life after cancer, mentally, emotionally, any other way? Do you feel you were prepared? And if so, how? And if not, how? And I'm going to let you guys jump in. If there's significant fighting, I'll have to break it up. But for now, I'll just let you go ahead and you're ready. Or if no one talks.
I'll jump in there. My story might be a little bit unique in this group in that I was 13 years old. It was also the mid-1970s, and to the best of my knowledge, and certainly our experience, there just weren't social workers sitting waiting to help you out when you finished treatment.
Yeah.
The concept of survivorship clinics was decades away, and completed treatment, and the doctor said, we'll see you again in 3 months or 6 months or a year. That really was how it closed. And for a teenager, someone who just went through adolescence during all of cancer treatment, that was the formative time of my life. I mean, I remember specific happy memories of childhood prior to that, but really my life began when I was diagnosed with Hodgkin's lymphoma, and that is what I remember from that point till this, with all the late effects. So it completely shaped who I am.
Yeah.
I think I can definitely relate to you, Sailor. I was 22 when I was diagnosed, so kind of starting that young adulthood. And it's obviously a very pivotal and transitional time in your life without cancer. You're trying to establish independence. You're trying to get on your own cell phone bill. You're really trying to be like an adult. And cancer basically told me, like, no, sit back down. And then after cancer, I was one of the ones that thought they were going to kind of jump back on their horse and return to that normal that I had before. And no, and I don't know if any other survivors or thrivers have heard the word new normal, but if you haven't, I hate that I'm the first person that's saying it to you. But even establishing that new normal after cancer, and now it's interesting because I'm in the same place establishing this new normal after my mental health breakdown. So I think it's very similar, very different, but I was not prepared, and survivorship is not talked about enough. I think it is a whole different type of battle in itself. I have one of my girlfriends, I call her, she's one of my lymphomies, and she asked me, like, when does it get easier? She was in like 8 of 12 treatments. And I was like, she's like, is it going to get easier after? And I said, I hate to tell you, but no, it just gets a different type of hard. Like it doesn't stop. It's just different. So like Sailor said, it's like having no formal survivorship programs, like reach out to me directly the same way that the oncologist reached out to me was kind of disappointing. And it was just figure it out.
Yeah.
I think I'm going to echo both of you, but maybe more so Amanda, because I also was a young adult. I was 25, and I had these steps that I wanted to meet, into remission, into transplant and beyond, a year, 2 years. And it's difficult after that 2-year mark is when I really noticed, like, okay, what is my life going to be like? And I am still on an oral chemo, and navigating that while still feeling tied to the hospital system, but yet well enough that I'm okay, was really challenging. And it's still challenging. And I have to be gentle with myself and just know that this is what life is for me now. Whatever notion that I had doesn't do me justice to keep comparing myself to that previous way of life or previous without cancer type of life. So prepared? No, not at all.
So given that, the lack of preparation, what has been the biggest struggle, I guess, the biggest mental or emotional, mental health type struggle that you guys have had? And along that line, has it changed? Amanda, I'm thinking you just kind of mentioned that there was another break or another level, I guess, or another situation. Mm-hmm. So I'm wondering, what was it at first, and maybe has it changed for you guys over time in terms of what you were thrust into without knowing how to, cope with it?
Yeah. I guess because I brought that up, I can share a little bit. For me, my mental health, like, clearly that's why I'm a part of this conversation today. But, I'll be honest, like, at first, I think I kind of desensitized that I personally went through it. Mm-hmm. I didn't get the opportunity to join like those support groups and what the doctors tell you to do. And I did everything they told me not to do. I Googled and, but at first my physical health, or my mental health, had no strain. Like, I feel like I beat cancer. I put it behind me. I jumped back into my classroom. I started working again. And I kind of was just, and it's just, I think it's how I face my traumas. And mm-hmm. I've learned that in the past 6 months. I face it. I just put it behind me. And I keep on trucking as best as I can. Yeah. But that's kind of where COVID, I was like, hold on, let's slow down a second. Let's start thinking about all the things that you have gone through. And very quickly, I think the unknowns of COVID, the symptoms and all that's related to it are so damn similar to the unknowns of cancer. Every poke or prod that I feel in my neck or under my underarms, I'm like, I know it's back. I know it's my cancer. I know this. And I mean, back in March and April, it was like every cough or sneeze or earache or mild temp that I had, it was like, I have COVID. I know I do. Yeah. And I think it was just feeling so out of control because I felt it was like that PTSD that like everybody talks about, but it was just, I felt completely like not in control of my life, not in control of what was my future looking like. And the more I sent myself down a rabbit hole. So yeah, unfortunately I hit a pretty hard wall back in April, one that I never would imagine myself to. But it was almost like a delayed mental health hit from my cancer.
Interesting.
And I'm currently kind of in between job positions, COVID, and I just moved. So that's a transition. So there was a lot of like up in the air things for me that I just felt very unsure of. And it just goes back to that uncertainty of cancer and just how hard hitting it can wreck you, especially in on some dark days.
Yeah. How about the two of you in terms of hard times? Go ahead. No, that's what I was going to say. In terms of the biggest struggle for you.
Yeah. So my outlook in life, my cancer and transplant and still being on chemo kind of gave me a kind of a kick in the butt to try to do the best that I could to my cat's just going to keep crying if I don't hold her during this. I should have locked her up. So, how did it mentally affect me? Like, my body processed everything after 2 years later is when I really started to get into the nitty gritty of what did I just go through? What just happened? What am I still going to go through? Physically, all of the steroids and chemo depleted my muscles. So I had like some muscle atrophy issues, and coming from being an athlete and a runner, I became back of the pack, and that messed with me mentally a lot because I was always really, really proud of myself that I could keep a certain pace or do a certain mileage. So finding ways to still be active, but not have that competitive edge anymore. It's a different frame of mind. So it's like I allowed myself to try to be more free instead of confined. And because once I try to fit myself into this box is when I start to feel a lot of emotions that bring up past issues. And if I don't put myself in that type of constraint, I don't feel those past emotions abrupt. It's just what I am in the moment. I know that I'm doing my best. And spiritually, I was raised Lutheran, went through a private school, K through 8, went public in high school. And I definitely had a shift in high school where I was like, okay, I'm done with the church. I want to, kind of figure out my spirituality and my religion, and what it means to me. And so when cancer hit, it just kind of brought me back to my roots, and my relationship with God definitely strengthened, and I talked to him a lot more. And I think I still talk to him a lot more. I don't think I was ever per se angry at him for if I was blaming him for this. But it awakened finding the beauty in things that I never found before. So that maybe is more of a spiritual journey that I've been on post-cancer, and I love it. I absolutely love that part of it. So there are some tough things, but I've chose to find the beautiful aspects of life.
Yeah, definitely. Stan?
I was thinking about this. I think I've gone through at least 3 major responses over these decades. During high school and immediately afterwards, during the time I was really in the midst of treatment, in the thick of it, so to speak, my focus was constantly on death. I want to die well. I want to be admired for the way I die. I want to do a good job dying, because I knew that I was going to die. I was convinced of that from the moment I got the diagnosis. Later, well, let me insert this. I can't imagine that it is normal or healthy for anyone to miss adolescence. Just about the day you step into adolescence, to be pulled out of it and then to be dropped back into the world as an adult with adult level concerns, that's what it was like at the time of my diagnosis. I didn't get to ever be an adolescent. So when I had completed treatment, started college, tried to follow along with normal life of what all of my peers were doing. I made it about 2 years in college, so around age 20, 21 is when I ran away from home, like an adolescent might. And I spent the next 10 years just running away from home. Jumped on my motorcycle, traveled all around the country, yada, yada, yada. The kind of stuff that I might have done 5 to 10 years earlier. I eventually settled out from that and had, probably 20 years, maybe 30, a very normal, in retrospect, pretty healthy life, physically, mentally, emotionally. Got married when I was 35. And about 10 years ago is when all the late effects from my specific treatments, the type of treatments that were done back in the 70s began to unfold. And from that point on, for the last 10 years, there was a period there where about every 6 months there was a new diagnosis added to what I was dealing with. So the stage of life that I'm in now that I have a very significant coronary artery disease, emergency open heart surgery to deal with, that's all radiation-induced problems. So that's part of my cancer story. It's just it's like part 2, I suppose, with multiple chapters to come. And the changes, or the place that I'm living in with that right now, is how to live in constant pain and discomfort. I've been to the best specialists in the country, and some of it can't be treated because the type of drugs that are available conflict with drugs that I need for heart issues. And so I spend my life learning to cope better with being uncomfortable and gradually losing my strength physically in very many ways. So I focus a lot more on the spiritual and emotional these days. And life is good. I've come to terms with losing access to the things that I love most, like sailing and kayaking and bicycling. Those are things that are too painful to do anymore. But I'm going to turn 60 in about 6 weeks, and I'm still going fairly strong. Just watching the changes. I think the changes are being brought to me, and it's kind of, I have some say in how I learn to cope with these changes, but I don't get to pick what they are, what the changes are.
Speaking of coping techniques, I'm going to jump to that. Things have changed, right? I mean, you guys are all dealing with some form of new normal, whether it's not being able to sail or run or whatever it happens to be. What coping techniques have you guys developed to keep yourself going, I guess, to keep from sinking into that pit or rabbit hole, or however you described it? What have you guys found works? What have you found doesn't work for you personally?
For me personally, keeping active, whatever that means, whether it's just going for a walk in the woods, doing some light yoga, some stretching. I just know that I feel better when I am being physically active, and it takes, my brain goes somewhere else, basically. When I feel kind of anxieties creep up, breathing techniques help me, and visualization definitely helps bring me back down to reality, and knowing that this isn't real, like this isn't lasting. This is something that my brain is just kind of like cooking up, and it's not there. It's not, I mean, the pressures may still be there, but what I'm trying to bring a sense of calmness to myself, definitely helps with breathing, visualization. And I'm trying to think what else. Keeping a routine is also something that is big for me. If kind of out of my routine, I just feel a little bit out of it. So if I can keep some things the same without being too kind of controlling over my schedule, that helps.
Good. Thank you.
Definitely echoing Vanessa with just physical activity. And it can be something as simple as like just going for a walk up into Old Town, or getting out of the house, forcing yourself to put on maybe not real pants. You could do leggings, but just putting on real clothes, like personal hygiene, that kind of stuff. Fortunately, I had a really great opportunity to just completely immerse myself in a lot of dialectical behavioral therapy that I did for 2 weeks full time in the hospital, and then I did it for 8 weeks in a group setting, both intensive outpatient. And I mean, the things that I learned there, it was just, I have a toolbox now, is what I call it. And it's like, you have, I mean, Vanessa, the breathing, and I am absolutely a visual person. So like, people that, I think it's like 7, 4, 6, you breathe in for 7, hold it for 4, breathe out for 6. That does not work for me. What my therapist taught me though is like, you breathe in, you breathe out, you breathe in, you breathe out, and you like, so you're actually like looking at something while you're doing it. There's also an awesome one on YouTube that's like this really fun like shape that like opens and closes, and you breathe with the shape. But I'm like a visual person, so I need to see it. Where just like simple breathing exercises, my mind doesn't slow down enough for me to just do that. But kind of, I think my most helpful mechanism has definitely just been, it's called opposite action. And it's days, and today was actually a day that I would probably agree that I had to force myself to get out of bed this morning. And I think I was kind of like nervous about talking about all this, because it's not an easy, it's not an easy topic, and it's, you want to share everything, but you don't want to share. It's like, so I think I just had some thoughts about that, but I was able to kind of do the opposite action and get myself up, get moving. Like, I made breakfast this morning, and I was just like, I'm going to allow myself some time and give myself some grace when I need it. But definitely doing the exact opposite of what I actually feel like doing. But it's not easy. It is like,
No.
by no goddamn means is it easy. And I mean, none of the mechanisms are, like, none of those coping skills are. And I don't think they're meant to be easy. I think it's just meant, like Vanessa said, to get you back into like what's called that wise mind, where you're thinking much clearer than like, oh, the feelings that I'm having right now are just like, they're real. Like, I'm a sad person. That's all I am, is sad. I'm a depressed person. I'm just depressed. And it's one of my therapists told me, she was like, feelings are so damn conceited. Like, the feelings convince you that they're real. Like, that what you're feeling is, or like the emotions, not feelings necessarily, but more so the emotions, like that your emotions, oh, they're real. Like, you're feeling insecure, it's because you're insecure. Like, you're feeling sad, it's because you're a sad person. And it's like, no, that's not true. It's, you can be sad in that moment, but let that moment, acknowledge the moment, but let it pass. And I probably am trying to make myself sound like I got this stuff under control, and I don't, by no means. So nobody think that I do. But like I said, I have that toolbox that I can always rely back to, even when things get super, super hard.
That's awesome. Having the tools makes all the difference.
Yeah.
Because then you have the option of using them.
Right.
Awesome. Stan, did you have?
You guys are way smarter than I am. I just need to slow way down, and I need also, as you, to walk and look. I need to walk and look at what's around me. Sometimes I even stick a tiny little magnifying glass in my pocket. And if I want to stop and look at a pine cone, dang it, I'm going to look at all the details of that pine cone, because I've walked for almost 60 years and failed to do that. It's time. So the thing that's kept me going since about February, when things got hard for everyone, was kind of deconstructing and reconstructing a garden area in the back area of our house. I just dove into it without a vision or plan, and I just started digging things up and planting and pulling weeds. And I did that for 5 months straight, never looked up, and the time glided by really easily, and it was really super healthy time. So I've learned to love pulling weeds.
Awesome.
It's good stuff for me. It's a lot like raising kids. You will learn that.
Now, you've all mentioned in different ways COVID. How could we not acknowledge what has happened over the last 6 months now, at least? And I think, Amanda, at least you mentioned specifically how it was connected. For any of you, what has quarantine brought up on the one hand, and on the other hand, have you almost felt like you're better able to cope with it because of cancer? Is there kind of this one or the other for you, or is it kind of both in terms of this whole reality that we find ourselves in?
For me, I think it's definitely both. The transplant world and soon after is very much like safer at home, COVID, masks. So I was very much prepared for that, but wasn't prepared for all of the emotions to kind of come rushing back in. That's where it just felt like, ugh, why do I have to go through this again? It felt a lot different.
How so?
Because I think I was feeling good. I'm feeling good now. And right after, it was still like, am I going to get GVHD? Am I going to make it to 100 days? What is this chemo going to look like after my body went through all of this? So there was a lot more health stuff going on with me. And like Amanda said, the unknowns of COVID correlate really well with a cancer diagnosis and not knowing what's going to happen. So that was kind of more the scare for me, because I am immune compromised still because of the chemo that I'm on. And early days in transplant, because I've been neutropenic pretty much for 7.5 years, almost 8 years. And I've gotten really good at trying to keep myself safe. But it's all with diseases that have been known. So now this is something that's novel, and that scared me, and it was frightening, as it is for everybody, because we're all on level playing field right now. I just have a bit of a more compromised immune system that would make things more difficult, which I've dealt with in the past. So I know that part of it. So it's like, it's prepared me, but it's also given me some pause and thought. And another coping thing, going back to it, that Stan mentioned, gardening. Being outside, gardening is 100% a coping strategy for me. And being home, I love to cook. So I've done a lot of cooking classes. I've made some fabulous meals for myself and my husband, and that's helped a lot. So I feel like I'm doing something that's I can put love into.
Excellent.
I think in the beginning of the COVID times back in February or so, in the beginning I took a really pragmatic approach. The very first thing I did was went out and got my advance directives written, made sure they were to my satisfaction, and made sure that my family members knew exactly what was in them, because in the very beginning we were told that it was going to be really bad, really fast for some of us. So I don't have any regret about having that in place. It has actually turned out then over the next 6 months to give me lots of peace of mind. I've had one ER visit since then for heart issues, or actually, we can talk about that later, heart, which turned out to be anxiety issues, not heart. But I was glad that paperwork was done and in place, and had already been placed with my hospital and doctor's offices. Other than that, I felt, because of these past 10 years of my cancer story, which is really a heart disease and osteoporosis type story, that I was well prepared to handle it. Slowing down my pace in the extreme is what I've done.
Sailor is much more wise than I am. And I think he tried to rub off on me as my volunteer at camp, and he taught me such great life skills just to take out and just go out in the world with. But I did the complete opposite. I had a hard time slowing down. Like, if anybody knows me knows that I am on the go all the time. I I have struggled with ADHD my entire life, including into my adulthood.
Yeah.
So to slow me down was just like, kind of like a hurtful thing to do just to begin with. And then
Yeah.
we try to make it fun and try to quarantine with our family and stuff. And it was just like, we were trying to do what we could, and trying to plan effectively to keep ourselves, like we were trying to prepare ourselves the best that we could. And I thought I was, and it was a Sunday that we were watching church, something that we do routinely. And I adore our pastor so much because he actually talks so much about like anxiety and his own struggles with it. And like, it's like, what pastor admits that he has anxiety and he struggles with being a man of God? Like, it was, so by no means did church bring on anxiety on to me, but it was a Sunday that I kind of was brought down to my knees. And by no means, like, as kind of Vanessa was explaining, I can't really relate it to cancer for some, like, I can't relate it to what it felt like to be under a doctor's care. I was part of a clinical trial, so I had like 14 sets of eyes on me at all times.
Yeah.
I had a plan in place. Like, I knew, and I feel like I should go ahead and preface and say, like, I am fully aware that like there are a lot of people with cancers that don't always get an end plan, that don't get 6 months of treatment, and then it's like, yay, you get to celebrate that.
Yeah.
I feel very blessed that I did have that. Whereas when I got hit with the mental health stuff, I mean, never in a million years did I imagine myself in these shoes. Never. Like, I consider myself a very strong-willed person. I consider myself I'm very aware of my mental health and setting boundaries, or I've always been aware of that stuff. And for whatever reason, it took from Sunday to Friday. And by that Friday, I was admitted into a hospital, talking to a psychiatrist. And full blown. I slept probably 2 hours a night for those 5 days. And I was an actual psychopath. Like, between not sleeping and just being completely unstable, like, I just had a chemical imbalance basically. And it truly is such I think, not a blind disease, but a disease that doesn't get recognition as a disease. Because somebody can look at me and be like, oh, she's so happy, she's smiling. And I'll have y'all know I'm smiling right now, but 4 hours ago, I was a hot mess express. Like, it's like you go through valleys and highs. And I mean, you enjoy the highs when you can and just keep trucking through that. But for me, I think cancer did the complete opposite to prepare me for COVID. Exactly what Ben said. Like, there were so many damn unknowns that I was just like, they're telling us to wear masks, now they're not. They're telling us to wear gloves, now we shouldn't. And it was just like, somebody give me something, like, tell me what I'm supposed to be doing.
Right.
Like, kind of, I mean, I always felt so safe when I was at my oncology appointments. Like, I hated getting chemo, but I knew that I was in that chair. And like I said, I had that 14 sets of eyes on me where I knew I was safe. I knew what was about to come later on that night. I knew what I was going to bring on. But yeah, COVID shook me. And I would probably say shook me harder than cancer did in some aspects. But it is a journey, which I'm learning. And it is not linear, like my cancer journey was.
Yeah.
So I'm learning.
Excellent. That's what it is. It's a process. We do have a question from someone who is watching, who says, I had relatives who had cancer. One of them decided to stop treatment. She said she was tired of it. Did any of you ever have a moment where you considered stopping treatment? Also, are you more emotional now than before? So those are two separate things. So one, did you ever have a moment when you considered stopping treatment? And then two, do you find yourself more emotional now than treatment? I can answer that. Yes. Go ahead. I'll let the rest of you answer.
I'll go ahead and answer real fast while I'm unmuted. during chemo, I was actually put into remission in between the start and the end of my chemos. And they basically told me that I needed to continue the next 6. And it was not going to get easier. If anything, it was going to get harder because my body was never bouncing back to that 100% that it once was at the beginning of things. So I looked at my mom and I was just like, I technically don't have to. Like, it's not, but I did because it was preventative measures and whatnot. But I have made it very clear to my mom and my boyfriend and just like my family that, like, heaven forbid, if I ever am diagnosed again, I don't know if I have what it takes mentally in me to put my body through what I did before, because now I know the effects that it had on me. I feel very stingy and almost ungrateful for saying that, because I know that there are so many people that are like, give me all the treatment that I can get right now. And it's just at a place where I'm at where it's like, it wrecked me, like I said. And in regards to being emotional, sweet Jesus, yes. Like I am a basket case of emotions.
Yeah.
So yeah.
Yeah.
Emotions, obviously, yes.
Yes.
I used to make fun of my mom for like crying at, commercials or something, and I am that person now.
Totally.
But it's okay. I think it's endearing to see people wear their emotions on their sleeve and knowing that they feel so much in the moment. I think it's actually a beautiful thing to witness. So I don't think it's a bad thing. And as far as stopping treatment, so I relapsed at my 100 days, but it wasn't phrased to me as if I relapsed. It was just that you're going to go, I was on a study for the chemo that I'm currently on, and they're like, you're just going to go back on it. Your levels will drop. It'll be fine. And it wasn't until I think my 3 or 4 year checkup where my oncologist follows me now instead of my transplant doctor. He's like, no, you relapsed, and that's why you can't come off your chemo, because if you did, we don't know statistically because of your age and the rarity of having that mutation with ALL. We don't have enough research to say, yes, it's okay to come off. No, you should stay on because we know that this is, going to come, it's high risk for you. So in order for me to think about having a family, I would need to come off if I wanted to do anything with me biologically. And there was a time where I was considering it. And I was like, am I living my best life by being held back because I can't start a biological family myself? And that's kind of where my therapy session started, where I was like, okay, I can't keep doing this by myself. Like, I need to talk to somebody outside my family, outside my friends, and go from there and figure things out. And she phrased it in a way that, because I couldn't freeze my eggs, I would have died in that process. She put it in black and white for me, and I never saw it in black and white. So when I did, it was something that's like, aha, like, okay, this is not going to happen for me biologically, because I want to stay safe. Like Amanda said, if I were to relapse, do I want to go through all that again? Would my body be strong enough to handle it? Would my mind be strong enough to handle it? I know there's a lot of second line, third line treatments for me that would be available. But like Amanda said, I don't want to even go there. I'd rather view this chemo as my safety net and not something that's hindering me. And that was something that my therapist posed to me. And I still, some days it's hard to view it like that. And that's not something that's keeping me from doing things like my non-cancer friends can do. But like I said, being in that box, comparing myself to this, it's no good. It's not good to do. So.
Yeah. Good.
It was a long time ago. I don't remember a time of ever saying, no, enough is enough, stop the treatment. But, when you're a teenager, you think you're immortal, though, as I said, I was thinking about dying all the time, but you think you can overcome anything that treatment may throw at you. So that was not an issue. I would say it's an issue now, though, in part 2 of my life with heart disease and potential treatments going further as my heart slowly becomes more and more debilitated. I think that I've made decisions about when enough is enough, heading down that path, and have already said no to some things that are technologically available, but I am not interested. I'm not sure that's quite the way to phrase it. In surviving merely for the sake of surviving. I've got a lot better idea about what life is about now. Had an experience. Well, dang it. That wasn't supposed to happen. Had an experience during heart surgery, sort of a taking a look at the other side experience while I was in surgery, and feel really comfortable with what's waiting for me. Let me just leave it at that. So, yeah. And talk about emotion. For dealing with my osteoporosis, my doctors had me taking both testosterone and estrogen in different forms. So it gets really weird sometimes.
Yeah, I would imagine. Well, speaking of medication, we do have a question. How do you manage anxiety without medication, if you are doing so?
I don't manage it without medication anymore. We have, with having teenage sons in the house and being nearly 60, and having a cardiologist who's very clear spoken and adamant about what I can cope with any longer with this type of heart disease has made it very easy, very cut and dried. I take medication on a nightly basis that is an anti-anxiety medication, and I carry another one with me as a crisis dose, different type of medication. Because I have unstable angina, chest pain can start at any time, with or without exertion. I carry nitro with me in my pocket all the time, and now carry my crisis anxiety medication in the same bottle. Our 25th wedding anniversary was just a few weeks ago, and as we sat down for dinner that night, I said, can't keep doing this, take me to the hospital, because I had been battling chest pain for about 12 hours and saying, no, that's not what it is, that's not what it is. So we spent actually our anniversary evening in the hospital, and that's where the doctors convinced me, said, stop. We've done every test we can. This is anxiety, which is imitating your heart problems, but it is worsening your heart problems. It's not your heart, but it's worsening it, and it's going to become a heart problem. You need to start carrying this with you. You need to take it as you begin to get ramped up. And so I just smile, I laugh, and you know what? That's just part of my life now, and it's fun. Yeah. It's okay, and I don't feel any stigma about it. I laugh about it all the time. So I'm glad it's there. I've different times in my life, more for depression than anxiety. I've been on SSRIs, SNRIs, probably 3 different categories of medication, and eventually dropped off of each one of them because I did not like the side effects, and I was willing to battle it alone without them. But at least I know that how effective they were or weren't, and that they are out there and available if I take care of that right away.
I do not take any medication for anxiety, but I urge you, if you do have anxiety and you are not able to cope with it, definitely talk to your doctor. But for me, it's similar to how I cope with my cancer diagnosis, how I'm dealing with still being healthy but sick type of thing, ball and chain with the hospital. It's exercise, it's meditation, it's yoga, it's visualization, it's breathing, cooking, gardening, keeping myself doing the things that I love instead of being idle. And like Amanda said, doing the opposite of what you want to do or what your brain is telling you, stay in bed, stay in bed, stay in bed. Nope, get up. You gotta, keep your personal hygiene up. You have to find things that are going to motivate you. And when you're not motivated, who around you can help you? Definitely reach for others, because like Amanda said too, there's not, mental health is still kind of shamed, I think. And telling others that you're struggling or you're having a bad day, or that, I just need somebody to talk to, or I need somebody to go for a walk with me just so I can get out the door. I can change my scenery. Those are all things that I ensue to help me without medication. So, but if you're experiencing anxiety and nothing is working, go talk to your doctor.
So this topic is probably one of the most challenging of this new journey that I'm on. I am definitely somebody that has had a hard time just accepting that, like, I need medication and it's okay. One therapist that I talked to got through to me, use an analogy to say, consider your medication like a life vest, and like you can kick your feet as quick as you can in the water, but like if you're exhausted and tired and your body, and for our case, our mind is just tired and can't go on its own, it's okay to put the life vest on and it's okay to need it. I unfortunately have had some pretty long lines of addiction in my family. And that is just where kind of my heart hurts to know that, like, I am relying on medications. I'm looking forward to the day that I can begin to come off of some of them. And my mindset has absolutely shifted. Like, if this is what I need to survive, like, it's fine. Like, it's one of the medications. Weight gain is a huge side effect of it. And I mean, I don't want to offend anybody by saying this, but I tell my psychiatrist, I'd rather be fat and happy than suicidal again. It's just, but I do look forward to the day that I don't need medication. Especially being on some pretty intense ones right now. I'm on some ones that are classified as kind of intense, and I can't have any wine on it. I can't so I struggle with medication. I struggle with having to need it and having to stay on it. Another analogy that my constant therapist has said to me now, and Paisley's thumping. But another analogy that a different therapist told me was like, because I was like, I'm ready to get off of it. Like, this is it. Like, I feel okay. And that's not how it works. Like, of course you feel okay, but then you're going to hit a valley again, and then you're going to be on top of a mountain again. And she said, if you're outside, it's pouring down, raining, and you're holding an umbrella in your hand, and the umbrella is working and it's keeping you dry, would you move the umbrella? Would you take the umbrella away? Like, I was like, all right, you got me all figured out now. Like, I clearly understand best through analogies. But in regards to coping without medications, I obviously can't speak directly to that, but what I can say is meditations and like those mechanisms that are like to slow you down are much more easier for me to accept, to grasp, to be open-minded to. Mindfulness is more easier for me to grasp with medications because of medications. So it kind of goes hand in hand.
I think because you've all mentioned it, this is taking the shame out of it. I mean, and that is what I think needs to happen with mental health in general, is this taking the shame, the stigma away, so that you're not suffering in silence. We just have a couple minutes left. So I think what I want to do is I want to ask you guys if there's anything I haven't asked you about, and there were a few questions that we didn't get to, but I'm wondering if there's anything a tip, a suggestion, something you wish you would have known, something you've learned in the journey of kind of dealing with mental health. If there's anything I haven't asked you about that you would want to share as kind of a parting thought. I really thank you. Those of you who have been giving comments and questions, thank you for doing that. But I think that's how we'll close. So if any of you have anything that you want to share, just go for it.
Sailor, you have the most wise words. Like, you have to finish this off. For me, it's like we keep talking about that stigma.
Yeah.
Like, and I just sat here and told you guys, like, I feel like I was almost a hypocrite of like, oh, I never thought I would be one to struggle with mental health. I don't think anybody that struggles with mental health expects to struggle with mental health.
Yeah.
But the way that it brought me to my knees and wrecked my life so quickly, uprooted every belief that I had of normalcy. And I mean, I grieve. I mourn the life that I had 6 months ago before April 10th happened. And it's, get help. Like, there's nothing wrong. And also, I think everybody's probably heard it a million times. If your first therapist, you're not clicking with them and you're not vibing with them, and do not be afraid to just be like, hey, it's not really working for us. Like, I would like to see somebody else. There's nothing wrong with that. It truly is just like Tinder. Not that I'm on Tinder. Michael's going to come up here. But it's like, it's okay for you not to hit it off with your first therapist.
Yeah.
Same with support groups. Like, you don't think you need a support group, but the second that you're sitting in right now a virtual circle, as soon as other people start talking, you feel so much less alone because you're not alone in it. Like, it's like, there's 3 of us here in such a small community. And it's, I mean, it takes a lot of vulnerability. It takes a lot of like putting your pride aside and saying, I need help. Like, it's simple. It's not as simple as that, but it's just admitting that you need help.
Yep. Thank you.
I think my last word would be the topic of suicide specifically, and this is not something that would fit for everyone or be possible for everyone. I know that, but for me, with dealing with suicidal ideation at different points, I arrived at a point where I needed a rational piece to the argument to hang on to of why that's not the direction I should go and feeling like that. And it came to me more like a picture in my mind, so I'm struggling to put it into words. I try to keep it simple. It was just that my life, anyone's life, is like one of many pebbles, I suppose, being dropped into a pond with the ripples going outward. And I have no way of knowing
Yeah.
how many lives or whose life my life is going to intersect over the course of my life.
Yeah.
And if I choose to end it, perhaps prematurely, I don't know how many people are going to, let's say, suffer. That's maybe too strong of a word, for never having crossed paths with me, for their ripples never having been crossed by mine, never having seen just an expression on my face, or heard a word from me, or walked with me on a hike, whatever it was. If I stop it because I find life unbearable, who knows how many people's lives will be altered forever because I wasn't there to play some simple or profound role in their life. I guess yeah, I'll just leave it there. That has been helpful to me many times.
Thank you.
So I will echo both of you. Stan, for sure, and Gail knows this part of my story because we were at the camp together. I went finally and got in that vulnerable spot and talked about, why did I survive for this? I never was feeling like I wanted to end my life, but I just didn't know why I survived to have that ball and chain, to still be on chemo, and not knowing what my life was going to be like. Why did I survive for all these doctor's appointments? Why did I survive to have this kind of half life, if you will?
Yeah.
Where late stage side effects, where Stan, you are full blown experiencing those things. Your mind goes into funny places, and I decided to talk about it with these 12 other women that were in my group. And like Stan said, all those ripples of people that you don't know if you don't share. And that's part of the reason why I joined tonight. And like Amanda said, like, this is stuff, it's hard stuff to talk about. But I was like, if I don't join, if I don't talk about this stuff, the people who are viewing, you three who are with me now, it's just one less person that I could be helping. And I'm not going to say no to that. So thank you guys for having me on. And I enjoyed talking with all of you.
Well, you guys are awesome. Seriously, thank you so much for being vulnerable. Thank you for being honest, for sharing things I didn't even ask you about. I know just from reading the comments, you guys have touched people. And I think what you've all said is if we can take away that stigma, if we can take away that sense, reach out. If you need help, please reach out. There are resources in the comments. We've had the suicide hotline up there. Please get help, ask for help, and know that you're not alone. That's the other thing. I think that's one of the things I got from going to camp too, is realizing you're not alone in this, even though we think we are. And this is another area where you are definitely not alone. So you three, you all are awesome. Thank you so much for coming on today. And we will have another episode in 2 weeks. So tune in again.
Thanks, Sunshine.
Thank you. Take care.
Thank you. Bye, everyone.
Bye.
Epic Experience was founded after my oldest son, Michael, was diagnosed with testicular cancer in 2007. I wanted to offer up hope to other cancer survivors so people know they're not alone, so that they know they can get out and start living again. It just may look different than how it did before they had cancer.
Epic Experience is unique in the fact that we really pride ourselves on trying to take anyone and everyone that we can. It doesn't matter when you were diagnosed. If you've been diagnosed 5 years out, 10 years out, 20 years out, we don't put a timeline on it. We say that, you know what, if you've had cancer come into your life, we have a place for you.
Epic Experience, One word, it's epic. You have a chance to come up here and do some things that you've never probably done before.
This camp has taught me, like, why are you afraid? Like, what's stopping you? I got out on the water in the pond here, and I'm like, I haven't done a headstand in a long time. And it's really difficult to do it on water. And I'm like, what am I afraid of?
At camp, it's about healing your soul and your spirit and living beyond that cancer diagnosis, having fun, being with people that understand, and really just embracing everything that life has to offer you.
They just said you were going to go to a camp, and I didn't even know where it was going to be. I got hauled up the mountain and got to play in the snow, and the thing that happened is I rediscovered joy, found myself again. Favorite memories from camp? Running down the hill in snowshoes. It's something I never really considered before.
I got on a sled today, and I'm going to be honest, I mean, I've beat cancer, but I was still nervous to get on a sled.
Well, kayaking is individual. You're all alone in your boat, and it's you versus the elements and how strong you are and getting through the challenges that are coming up, whether they're rapids or something in the water in the way. And with cancer, it's you versus your diagnosis.
Epic Experience is about empowering adult cancer survivors and thrivers beyond their cancer diagnosis. It's about giving them a community in which they feel that they have people they can connect with, that understand them, and have walked their shoes to really know, hey, you know what? I'm not alone, and I have people with me, and it's so important for them to feel that connection.
Things that I used to worry about don't worry me as much anymore. Family is critically important. Friends and experiences is what life is about.
Well, I didn't think I needed this week, but I needed it more than I knew. I needed to just play in the snow. I needed to laugh until my sides hurt. I needed to connect with people, even though I didn't think I did. I needed to find out that I'm not alone in things I think I'm alone in.
So here at the 7W Ranch, not only are the activities that we do for the week amazing, but just the beautiful scenery around alone makes it just so incredible.
I was feeling a bit lost and unsure how to cope with life after cancer. I feel like Epic Experience brought me closer to who I used to be and who I want to be in the future.
Only to cry when I talk about 7W? It's magic. You say. It's special.
If you are debating on coming on this trip, just do it. Don't hesitate. I hesitated. I waited till the last minute, and I am so grateful that I came here.
This has been life-changing. This week has absolutely changed my life in ways that I couldn't have even imagined that it would.
Epic Experience is the right name for this experience. Trust, go for it.
Why can't you experience this? It's something that they've already been through, cancer treatments, whatever the therapy is, and this is another way to heal.
If you want to really check back in with yourself and find out where your inner person is and where your soul survives, come to a camp and just let it be.
Don't think about it. Don't wonder, should I? Just do it. Sign up for camp, and it will be an amazing experience full of a lifetime of memories.